Dr. Padilla, what's your reaction to the way the governor put it there?
Well, Lawrence, I feel the frustration, right? Because the greatest human cost is being carried by people who are unvaccinated. But in medicine and public health, we tend not to blame the people who are carrying that cost. We tend to not to blame the patients, and we tend to look upstream to try to figure out what brought them there. And the truth is, for most people who are at this point, there are still people, pockets of people who need their questions answered. And I think that we need to continue to work to do that, to instill more confidence in the vaccines. But for others, they're being fed a steady stream of disinformation and misinformation, and even the efforts to get the vaccinations out or to take any public health measures have all been politicized. Door-to-door outreach was politicized. Vaccine mandates are politicized. Mask wearing is politicized. And they've been told, a section of the population has been told that COVID is no worse than flu, which has led them to now say, well, then why should I take a vaccine? And I think that's what's leading to this. And we have to work the rhetoric back. And for governors like Governor Ivey, I would insist that the way that we go about this is to continue stressing the importance of vaccines and making vaccination as easy as possible for people and potentially mandating it in universities and schools and hospitals to increase that uptake.
Dr. Rodriguez, what was your reaction to the way the governor put it?
I would totally agree that we need to have empathy. I think blaming people is not the way to go. Most people, I'm an altruist, and I believe that most people really care about their families, they care about their community, and their decision to not be vaccinated is based on fear for themselves and their families. So it's really about going into these communities, having conversations with our patients, and really addressing their fears and talking about the reasons why vaccination is important.
Dr. Padilla, at what point does the refusal to get vaccinated become kind of the medical equivalent of, say, cigarette smoking and lung cancer?
I think we're there, right? Because I think it's similar to smoking. When you don't vaccinate, it's not just about your body and your health, but when you don't become vaccinated, you potentially might get infected and pass that infection to other people who are not vaccinated. A portion of people who are vaccinated may be immunocompromised, because a community that is highly vaccinated, in that community, you're less likely to see a single person is less likely to get infected, less likely to get hospitalized or die, less likely to have long-term effects, and most importantly, less likely to come across other people who are infected. And that's why I think we need to stress that communal aspect, that it's not just your family, your health, it's actually your community's ability to get back that's gonna depend on that high level of vaccination.
Dr. Rodriguez, you're in Florida. That's one of the states that's leading the increase in infections. What is your experience there now?
So I've seen an exponential increase in cases over the last 2 to 3 weeks. Every day that I go in, there are more and more cases, mostly children. Obviously, that's what I see. And then obviously the complications associated with that. And then it's in the community as well. Children obviously don't have such a significant illness, mortality, morbidity as adults do, but they do spread it to their caregivers, their grandparents who are elderly, who have chronic conditions and are more likely to be hospitalized and have fatalities as a result.
Let's listen to what White House Press Secretary Jen Psaki said today.
We're reached a point where there are some communities, even states, where there's 70%, 80% or higher vaccination rates. Other communities where there's 40%, 50% or otherwise. That's not just a health issue. It's a huge health issue. It's an economic issue. We've seen how that can impact local communities as it may lead to shutdowns of different businesses. It's an economic issue as well.
Dr. Padilla, do you see anything changing this pattern?
I have some hope, Lawrence, that we might be seeing something. The states that are actually seeing the greatest increase in the rate of vaccinations are actually those that are the heaviest hit. So maybe some of this message about the vaccinated, unvaccinated creating the greatest burden or carrying the greatest burden may be coming through to some people. But, Jen Psaki is exactly right. And that reality is not just true here in the U.S. in terms of the states that will be able to get back economically, socially, psychosocially, but also globally. The longer these outbreaks go on, the more the longer the recovery will lag for those communities.